Welcome to the IPP section. In this video, we will go over everything in regard to what an IPP is, P&I balances, goal settings, implementation, and interdisciplinary collaboration. Upon admission, each resident will undergo a comprehensive assessment conducted by our interdisciplinary team, which includes healthcare professionals, caregivers, and the residents themselves. The assessment will cover various aspects, such as physical health, cognitive abilities, emotional well-being, social engagement, and personal preferences. Our team will develop an individualized care plan that outlines specific interventions, activities, and support services tailored to meet the residents' goals and needs. The care plan will consider factors like medical requirements, therapeutic interventions, social activities, and emotional support.
We're going to talk about IPP. It stands for Individual Program Plan. So each resident has this in their binder. This is their binder, and you can find this over in the staff room shelf. Okay. So what is in the IPP? So IPP has a lot of medical information of the client. We'll ask for their height. You can find that in doctor's appointments. Weight, we should have a record of that in their medical binder. If they have a conservator is a person who says or decides for them where they live, how much money they should have, who they can see, where they can be. P&I balance is how much money do they have here. P&I stands for personal and incidental. So each of them have money that comes from their payee. Payee is the person who holds their money, and if they need more money, that's where we ask money for. Okay, so this information, payee, P&I balance, I took from her P&I book. This is her personal and incidental book, and it records her expenses on different dates. So all these have to correspond to a receipt. Now this is her balance, and 8606 is what I put over here, 8606. Okay, so all these have importance in why we have to have them. First of all, this document itself is a document, it's a legal document stating that this is all of Jessica. Jessica is the one who will have the meeting on Friday. Okay, we're going to have the meeting with her service coordinator, who is from the Alta Regional Center, and with Jessica and whoever she wants to invite to that meeting. They need to see that she's had an annual physical appointment this year, dental, optometrist every 2 years. Now, some of our residents here goes to a psychiatrist or has gone to a psychiatrist. Jessica does not have a psychiatrist. She has a podiatrist. She does some hearing testing. Neurologist she does not have. So just fill in whatever is appropriate. Physician name, address, telephone number, date of last exam. Now this information, the regional center has access to the providers who gave her the services, so they can check our information. And of course, it's also important that they really receive the services. Okay, medications, it's bigger than this, but this is just a form that I printed off. I'm still gonna fix this, but medications, they need to know if there are changes in medications. And then side effects, if she's had any side effects. So earlier or some other time I talked about medications. Okay, so going to the MAR of this med binder, And when you open, medications have some side effects. If you observe that Jessica, or if she has complained of any of those side effects, then that's the information we put into this spot. Medication side effects. If she's been hospitalized, that should have been followed up by a special incident report. We should have submitted a special incident report. There are other special incident reports that could have happened during, this is an annual report, during an annual, the last year, for the last 6 months, since we have to do semi-annual. And we put that information there. If she's had some blood work done, and blood work, that's all blood work. And then immunization, and then special incident, like I said. And then we have to put down what activities she's had. So in the logbook that we have, we can't just put that she went on an outing, but we have to go ask her, where is she going? She usually goes out with her boyfriend. Where are they going? They're going out for lunch. Over here, this is really the essence of the IPP. The IPP, this summarizes her goals, where she wants to live, who she wants to live with, how she wants to spend her day, what her goals are for the future, what she wants to do. Okay, so the one who we make our own report, but the regional center, the service coordinator, comes up with a report that looks like this. Okay, each individual living in this house has a report that looks like this. It shows the participants and the goals. Now, it's important that all of us staff would need to read this because there are things we have committed to do with her. So she wants to continue living in this facility. So there are things where it says RSP or FA. That RSP stands for Residential Service Provider. That's all of us. And even if it says FA, which is Facility Administrator, that goes for all of us still in this house to perform all these duties that are expected of us. Okay, so go ahead and read this as part of your training.
IPPs will be reviewed at least once every year to ensure that they remain relevant and responsive to the residents' changing needs and aspirations. During the review process, the resident or their legal representative will be actively involved in discussing the progress, modifying goals if necessary, and providing input on their care plan. At Tropical Villa, we believe in providing person-centered care that respects the unique needs and goals of each resident. Our individual program plans are designed to achieve this by developing personalized care strategies that promote physical, emotional, and social well-being. By working collaboratively with our interdisciplinary team, residents, and their families, we strive to create a supportive and fulfilling environment. If you have any questions or would like more information about our IPPs, please don't hesitate to reach out to our staff. We are committed to providing the highest quality of care to our residents. In this video, we went over everything in regard to what an IPP is, P&I balance, goal settings, implementation, and interdisciplinary collaboration. Now, please read over all of the residents' IPPs to get a better understanding of them.